Hello there, welcome to your Bone and Joint channel. This is Dr. Shayesteh, your orthopedic surgeon. Today I'm going to discuss about carpal tunnel syndrome. So let's see what is the carpal tunnel syndrome. What is the definition? In carpal tunnel syndrome, the main reason is pressure on the median nerve in the wrist area. So pressure on the median nerve causes all the symptoms in the carpal tunnel syndrome. As you can see in this picture, this is the area of innervation of the hand by median nerve. That's in the palmar area, palmar side of the hand, and this is in the dorsal side of the hand. And as you can see, thumb, index, middle finger, and half of the ring finger innervates by median nerve. And in back of the hand, or dorsal side of the hand, index, half of the index and middle finger, and part of the thumb again innervates by median nerve. So what are the main symptoms? Numbness, tingling, weakness in the hand and arm. This is another picture again. You can see symptoms in the carpal tunnel: burning, tingling, and with or without pain, but most of the time there is numbness and itching. This is a beautiful picture which it shows the cross section of the wrist area and the position of the median nerve. As you can see here, that's a median nerve, and this is a transverse ligament over the median nerve in the wrist area. And these are the bones and the tendons. This is another picture here. You can see that's the transverse ligament, and the yellow lines are the median nerve, and these other elements which shows like blue here, they are the ligaments in the wrist area. So any reason can put pressure on the median nerve here can create the signs and symptoms of the carpal tunnel. This is another picture here. You can see these are the ligaments, tendons, and the bones in the wrist area, and this is our median nerve here, which sits here exactly right down there. This is the yellow picture here. That's the median nerve. Here again, you can see this yellow is median nerve. It passes through the wrist under the transverse ligament and goes through the thumb, index, middle finger, and half of the ring finger. One more picture here. This is a normal carpal tunnel. There's no pressure here. That's the area mostly gets median nerve gets stuck and gets pressure. And here is the inflamed and diseased median nerve that's under pressure. You can see swelling and inflammation here. One more picture. This is the radial bone, ulnar bone. These are the fingers, and this is the transverse ligament, median nerve, which passes through the wrist and under transverse ligament, gets inflamed and swollen, thickened here, and creates all the symptoms of the carpal tunnel. So we said tingling and numbness. As we mentioned, in the fingers of the hand, and usually mostly in the thumb, index, middle, part of the ring finger usually affected, but not little finger. So if there is any numbness, tingling, or pain, or anything in the little finger, which means that's not just a carpal tunnel, there must be some other reason for that symptoms. You might sometimes have a feeling of electric shock in the fingers. This is another picture. You can see that's a beautiful picture here. This is the median nerve. That's the area that gets under pressure under the transverse ligament, and all these fingers, which they innervate by median nerve, they get painful. Sometimes you might feel the pain while you are holding a steering wheel or driving. You are holding a phone and having a conversation, reading a newspaper, or even sometimes when you are sleeping, you might feel the pain, and it sometimes wakes you up. People used to shake out their hand to feel relieved or get rid of the pain. So while driving, having a phone conversation, combing your hair, or even reading newspaper, you might feel the pain, numbness, tingling, and the burning sensations. And people might get the painful hand while they are sleeping, and they might wake up from their sleep during the night, in the middle of the night. These feelings, sometimes they are just in positional. In some position you feel you have it, driving or holding the phone, or sometimes yes, sometimes no. But over the time, as the disease progresses, numbness and tingling and the pain gets constant and stays there all the time. You might feel some weakness in the hand even, or drop the objects, because apart from the numbness and tingling and the pain you feel, you might feel the thumbs pinching muscle gets so weak and you can't hold the things. You're going to drop the object. So what are the causes? As we said, anything puts pressure and causes pressure on median nerve creates the problem. Most of the fingers involved, except the little finger, thumb, index, middle, and the ring finger, and also the muscle power in the thumb as well. Muscle power in the thumb as well. Okay, let's see what are the risk factors. Anatomic factors, first of all. Wrist fracture or dislocation or arthritis in the wrist area. They can tighten the carpal tunnel area and put pressure on the median nerve. People, they have a smaller hand, smaller carpal tunnel, basically, they get more involved. That's why most of the time the ladies, they were involved in the carpal tunnel syndrome. So the sex is important. Women, they got mostly, most of the time they have a carpal tunnel more often, and that's because of the anatomy of the area, and they have relatively smaller area in the carpal tunnel. Nerve damaging conditions like chronic illnesses such as diabetes, they can increase the pressure on the median nerve and create carpal tunnel syndrome. Inflammatory conditions, rheumatoid arthritis, and any other condition which creates inflammation in the carpal tunnel area can be the reason for the carpal tunnel. Medications. Some of the medications, it's been said, which usually some of these medications which used to be given in the breast cancer treatment, they can be the reason for the carpal tunnel syndrome. Obesity. Being obese is a risk factor for the carpal tunnel syndrome. Body fluid changes. Fluid retention situations like pregnancy or menopause are another reason for the carpal tunnel syndrome. And other medical conditions, as we said in menopause, that because of the fluid retention, and thyroid disorders, and kidney failure, and also lymphoadenoma, also considered one of some of the other systemic diseases that can be the reason for the carpal tunnel. Workplace factors. Anyone who works with the vibrating tools, drilling or assembly or working in assembly line can have carpal tunnel. They can be prone to the carpal tunnel because of the prolonged repetitive flexing and extension of the wrist can be the reason for the pain and putting pressure on the median nerve. And sometimes even working in a cold environment also is the reason for the irritation of the median nerve. And also people, they use a lot of computer in their workplace or mouse also. They are prone to the carpal tunnel syndrome. These are some of these vibrating tools in the workplace you can see. And of course those with prolonged computer and the keyboards, and especially those who use the mouse in the wrong position, they are prone to the carpal tunnel syndrome. So what are the measures that you can take to prevent the carpal tunnel syndrome? Reduce your force and relax your grip. If your work involves a cash register or keyboard, working long hours with the keyboard, for instance, hit the keys softly. For prolonged handwriting, use a big pen with an oversized soft grip adapter, or definitely use a free flow ink. Try to take always a short break. Even the short break between your work which you are doing, it can be very helpful. Gently stretch and bend hands and wrist periodically. Alternate tasks when it is possible, or if you are doing something that you can alternate your hand, try to do that. Alternate your hands. And even if you are working with the heavy machines or heavy equipment, which there is a constant vibration, definitely even a short few minutes of rest can be very helpful and can make a big difference. So what you can do for the prevention. Watch your form or your position or your posture, the way that you're sitting or holding your hand and elbow and typing. Avoid bending your wrist all the way up or down. A relaxed middle position is the best. Keep your keyboard at the elbow height or slightly lower. In this picture you can see a relaxed and the right position for your wrist and forearm, and try to have some of these tools or these type of things that you can rest your forearm and the wrist on them. So as we say, correct your posture while you are sitting. So the way that you are sitting, it's very important to avoid the carpal tunnel. If you are working in a cold environment, keep your hand warm, and even sometimes you need to have gloves while you are working during the day. Try to have something to support your wrist and the hand and keep it warm. So in order to diagnose, your doctor needs to have a history and examination. So this is your history. As we said earlier, carpal tunnel syndrome symptoms usually occurs while holding a phone or a newspaper or a comb or gripping the steering wheel or driving. They also tend to occur at night and may wake you during the night. Or you may notice numbness when you wake up in the morning time. There are some physical examinations which doctor has to do, and find out if it is just a median nerve and which part of the hand is involved, or there's symptoms in the little finger or other part of the hand as well. There's two specific tests, Tinel signs, or and Fallen test. Let's see what are these tests. First, positive Fallen maneuver, which means if you hold your hand in 90 degree, bend your wrist in 90 degree, within 30 to 60 seconds, if you have a carpal tunnel, the symptoms will start. You will have a carpal tunnel syndrome symptoms, tingling and the pain, specifically in the carpal tunnel area or median nerve innervated areas. So that's what we call positive Fallen's test. So your doctor may ask you to bend your wrist in 90 degree and hold it for a few seconds. This is the same again. Raise your arm, bend your wrist 90 degree and hold it for 30 to 60 seconds. If you feel the pain in this area and numbness and tingling, that means you have carpal tunnel syndrome. The next test is Tinel's test. If the doctor puts pressure in the wrist area and above the transverse ligament, the symptoms of the carpal tunnel has to start, or you may feel pain and tingling in the thumb, index, ring, middle finger and the ring finger. Again, these are the area which you feel the pain if the doctor's test for the Tinel sign puts pressure in the transverse ligament here over the above the transverse ligament above your median nerve. Again, Tinel sign, Fallen test, and Tinel sign. There are some specific observations in the carpal tunnel syndrome if the patient has the carpal tunnel syndrome without any treatment for very long. As we said, since the median nerve provides the motor function for the muscles in the thumb, after some times the patient might lose the waist, basically the muscle waist in the thumb area and in the palmar side of the thumb. So that's a very specific symptoms and signs we can see after long-standing carpal tunnel syndrome, which affects specifically motor muscles of the thumb. Here again, you can see the difference between the two hands. Again here, from the lateral side, you can see clearly this is a normal hand and this is a carpal tunnel. Tenar atrophy, we call it tenar atrophy. You can see that one. Again here, very clear both sides. So what are the things that we can do to help us for the diagnosis? The diagnostic tools. First of all, X-ray. X-ray can show us if there is any fracture, any dislocation, any inflammation, anything that we can see in the X-ray in the carpal tunnel area. The next thing is the nerve test, electromyography, and nerve conduction velocity. These studies are going to show us which nerve is involved, what part of the nerve involved in the wrist area, and which muscle is involved. So, nerve conduction velocity and electromyography. So, now we are talking the treatment of the carpal tunnel. What we can do for the carpal tunnel? First of all, the best treatment is start that one as early as possible. If you start the treatment early, you will get a better result. Take more frequent breaks between your work. Avoid activities that worsen your symptom and apply cold pack to reduce the swelling. These are the things that you can do by yourself. And as soon as you feel the pain or any of these tingling, numbness, and symptoms of the carpal tunnel, the better you see your doctor and seek for the treatment and advice. So what are the other treatment options? Your doctor might suggest for wrist splintage or medications or surgery. These are the options. This is the type of the brace you might receive or prescribed by your doctor. Here there are some exercises. You can take a printout of this diagram and try to repeat these exercises by yourself to avoid the carpal tunnel or reduce the pain and numbness and tingling. Active range of motion, finger exercise, wrist stretch, tendon glides, grip strengthening, wrist extension exercise, and wrist flexion exercise. They might look very simple exercises, but they are very helpful to reduce your pain and give you relief from the signs and symptoms of the carpal tunnel. Next treatment option is wrist splintage. It can be a nighttime splintage, which it can give you relief of tingling, and so it can be a nighttime splintage. It can give you relief of the tingling and numbness. Especially it's very good for those which they can't take the medications or they cannot go for the surgery options, specifically ladies with the pregnancy. And the good thing is, even when you are wearing the brace or splint during the nighttime, it can still give you a lot of relief during the daytime as well. As you can see, this is another brace here. You can use it during the nighttime or even daytime. There are medications, NSAIDs, non-steroidal anti-inflammatory drugs such as Advil or Martin AB, and corticosteroids, which we usually use as an injection in the area. These are the locations that we do the injection in the wrist area to reduce the inflammation and the swelling in the wrist. Usually your doctor uses ultrasound guide to place the needle in the right location and do the injection. As you can see here, this is the median nerve and this is the needle which we put the medication or corticosteroid here exactly next to the median nerve under the carpal tunnel area under the transverse ligament. Here, this is another picture. It shows the position of the injection in the wrist. Sometimes, as we said, carpal tunnel syndrome is as a result of inflammatory diseases like rheumatoid arthritis or any other inflammatory arthritis. In this case, we have to treat the disease itself. Treatment of the rheumatoid arthritis, it's going to improve the carpal tunnel syndrome. And then we have surgeries. If the patient doesn't respond to the medication, splintage, or any other treatment that the doctor suggests in the early stages, then we have to go for the surgery. The goal is just relieve the pressure by cutting the ligament or transverse ligament over the median nerve, which it passes above the median nerve. There is two types of the surgeries. Either we do endoscopic surgery, it is a minimally invasive surgery, telescope-like device device which we pass through the wrist without a big opening. We can use this telescopic device and do the surgery. Endoscopic surgery may result in less pain, faster recovery. As you can see, this is the picture. We use two telescopic device which helps us to cut the transverse ligament without opening the wrist itself. It's like a puncture with a small incision above and under the wrist area. And of course, open surgery. In the open surgery, that's the position of the surgery. Usually we do the opening in the palm area, and we cut the transverse ligament 2 to 3 centimeters with the palmar incision here. This is the location of the surgery site in the palmar area. This is the position of the hand. As you can see, this is the surgery site. Okay, that's our last slide. As you can see, this is the position of opening for the carpal tunnel surgery to release the transverse ligament in the palmar side. With this slide, I'm going to end the carpal tunnel syndrome section right now here. Please leave your question, suggestion, and comment below, and I will definitely try to reply your questions. And please do join to your channel next time. Thank you very much.